The Global Allergy and Airways Patient Platform believes we can all live better. Today we're going to talk about urticaria, which is often referred to as hives. Is your skin blotchy and uncomfortable? Do you live with rashes with intense itching? In just a few minutes, we'll help you learn the basics about these conditions. Urticaria is a common disorder. It can occur at any age, from infancy to late adulthood. 25% of all people are affected by it at least once in their lives. According to estimates, 1% of the European population currently has chronic urticaria, which is what it's called when hives last 6 weeks or longer. Urticaria in adults often occurs more commonly in women. Persons between the ages of 30 and 50 are most often affected. Among people 70 years of age or older, it occurs relatively rarely. In contrast, hives in newborns, which usually last only a few days, are not uncommon. Urticaria is characterized by the sudden onset of itchy wheals, raised bumps on your skin, and/or angioedema. Angioedema can be thought of as swelling. The skin of the entire body or only a portion may be affected. When the wheals occur only in response to certain triggers, cold, pressure, or sunlight, this is called inducible urticaria. When the hives seem to happen for no particular reason, this is called spontaneous urticaria. The affected area of the skin swells. On lighter skin tones, hives may appear red. On darker skin tones, they may be raised, but not a different color than the skin. The wheals seem to persist sometimes or to migrate or move around the body. Not infrequently, there is a deep swelling of the skin in addition to the hives. Itching is a main symptom for people with urticaria. Night itching can be extremely stressful because it disturbs sleep and it represents a dramatic restriction of quality of life. Employment, school, intimacy, and social and physical activities can be significantly affected. Many substances can trigger itching. The common feature of these substances is that they release a neurotransmitter called histamine into the tissues, which plays a key role in triggering that itch. Almost all of the histamine in your skin is stored in a type of cell called a mast cell. If these cells are triggered, that is the starting signal for the inflammation of the skin. As a result, the skin swells and becomes red and itchy, and those wheals form. There are several types of medications used to treat urticaria. Non-sedating antihistamines are the main treatment for urticaria and are preferred for long-term use. In severe cases of acute urticaria, or when antihistamines alone are insufficient, short courses of oral corticosteroids may be prescribed to reduce inflammation and relieve symptoms quickly. In cases of chronic urticaria that are resistant to other treatments, medications may be given that suppress the immune system, but these are usually prescribed by specialists due to their potential side effects. Biologic medications target immunoglobulin E, or IgE, which is involved in allergic reactions. It is sometimes used for chronic urticaria that doesn't respond to other treatments. It's important to talk to your doctor about over-the-counter or home remedies before use. It's important to be prepared for a doctor's visit for urticaria. Be ready to discuss when your urticaria occurred for the first time and how often hives have occurred since then. Are there triggers that aggravate your urticaria? Write down your previous therapies and medications you've used for your hives, the name of the medication, the amount of time you've taken it, as well as the dose. How well have these medications helped and what side effects have they had? Write down medications you're currently taking, even those not being taken for urticaria or that have not been prescribed by your doctor. And be ready to test tests that have already been carried out to find the cause of your hives and bring along previous findings. If you think you may be living with urticaria, please see your doctor. If you have urticaria, be sure you're getting the best treatment for you. GAP believes in empowering patients around the world and wants you to live better. For more information, go to gap.org. The mission of the Global Allergy and Airways Patient Platform is to globally support and empower patients with allergies, airways, and atopic diseases by protecting their rights and insisting on the duties of governments, healthcare professionals, and the general public. Please join us for another GAP Notes presentation.